Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Well, hello, everybody. This is Dr. Kurt Woeller. Welcome to the podcast. So I'm joined today by a Dr. Doug Stephey, who is an optometrist. And we're going to have a discussion about the eyes, vision, but we're going to get into topics that are more than just the importance of 20/20 vision or general things for eye health, which are important. We're going to get into vision therapy and get Dr. Doug, as he is often referred to, some of his insights into non-traditional aspects of optometry and understanding the eyes and vision as an extension of the central nervous system. Very important information. This is often, I believe, a topic in this world of integrative functional medicine that is appreciated but often overlooked, not thought of. And it's a really integral part of who we are as human beings, our development, our children's development. So, important information. So, Doug, welcome to the podcast.
Well, I'm delighted to be here, and I'm grateful for this opportunity because this information, it needs to be shouted far and wide, and it's been in the shadows for. I'm not joking when I tell you that my optometric ancestors started talking about this 100 years ago. That is not an exaggeration.
Well, and I believe it. I mean, I have experience going back to my days in practice as a cranial osteopath, which goes back many decades now, understanding the relationship of the eyes, vision, the central nervous system integration. Before we get into the topic, though, real quickly, give the listener a little bit of background of your education and how you got interested in this topic.
You bet. So there's a number of optometry schools across the country, more now than when I was a student back in the mid-'80s. And the school that I went to, the Illinois College of Optometry, gave us a good grounding and a good basic understanding of binocular vision. And that's always been a core part of how I practice and how I think. When I graduated, I did an ocular disease residency at a VA hospital in Baltimore, and then moved to California in '85 to teach in the ocular disease department at the Southern California College of Optometry. And that modality and that method of practice is about as far away from functional vision, behavioral vision, developmental vision, vision therapy as you can get. And so when I bought my practice in '88, I decided right out of the gate that I was going to have to hire a doctor to work for me part-time while I was still teaching, and we were going to do vision therapy. That was going to be an integral part of my practice. And here we are in 2024, and it's still an integral part of my practice, and you'll understand better why, and certainly your audience will have a new appreciation for vision as we transition through this process. And sometimes, especially if I'm interacting with a school district, and we'll talk about that in a little bit, I'm oftentimes referred to as just an optometrist. Mm-hmm. And so I would have your audience appreciate that if you imagine a two-circle Venn diagram, that's where most eye doctors are practicing. And one of those circles is, do you have a refractive error like nearsightedness, farsightedness, astigmatism, or need reading glasses? So we'll label that circle, can you see 20/20 with or without correction? And the other circle has to do with eye health. Do you have pink eye? Do you have glaucoma? Do you have diabetic retinopathy, macular degeneration, lupus-related, autoimmune-related issues related to eye health, and so on? But that's the second Venn diagram in the two-circle model. But I want your audience to appreciate that in this discussion, there's the missing third circle. And in the third circle of this Venn diagram, there are things like primitive reflexes, archetype movements, visual aliasing, magnocellular vision, postural deficiency syndrome, eye focusing, eye tracking, eye teaming, working memory, executive function, visual auditory integration, visual vestibular integration, visual proprioceptive integration, visual postural skills, and more. And when you pause and think about that for a minute, that is a lot of stuff going on in that third circle.
So, like most everybody, when you think about this thing of, oh, just an optometrist, I mean, that's so ridiculous. Most people, though, when they go to an optometrist, they get their eyes checked. You know, do you need reading glasses, as you described? That's been my experience. And then, of course, there's this discussion of eye health. We were talking about this, off recording, what foods and antioxidants can help, and these supplements that can help with eye health and vision. I'm interested in the part of this discussion, a major part of this interview, is what is in that third circle. Let's talk about that, because if you rattled off a few things about primitive reflexes and whatever else, and that was sort of gets to the point of my opening comments, that the eyes are an extension of the central nervous system, but an integral part of the central nervous system in how we form and develop and progress throughout our lives. It's not, the eyes are not a static system. Yes, it's how we see, and that's very important, but there's much more to it. So I want you to expand on that, give the audience a better idea about what is in that third circle. We're not going to get to everything, but a few things I want to touch on, like the primitive reflexes, because in some of the work, and conversations that you and I have had, one of the things about primitive reflexes that I've seen as a clinician working in the area of autism, for example, or other special needs kids, or individuals who've had brain trauma. So my early training as a cranial osteopath, I worked a lot in that realm, and nowadays work a lot with the autistic kids. The retention of primitive reflexes is a major problem to their development. So I want you to expand on that. So I want you to start this conversation. I'm going to kind of leave it up to you to guide this, and I'll jump in when needed. All right.
Colleagues of mine, 1940s, 1930s, 1950s, there's several terms that get kicked around to try to describe the way I practice. And it's oftentimes referred to as developmental optometry or neurooptometry or behavioral optometry. And so even though I think all optometrists should practice this way, or all optometrists, and they should, because they learned a portion of what we're going to talk about today, every optometrist in this country knows how to measure at least eye teaming, eye focusing, and eye tracking skills in that third circle. But too often, they don't. They've migrated away from the three-circle model and really confined themselves in the two-circle model. And people that have needs in the third circle, they're simply being overlooked. And to give you an example, and I'm going to rattle off some new diagnoses and connect it to the next thing I'm going to talk about. But if you have a history of migraines, TMJ, chronic tension in your neck and shoulders, have a panic disorder, anxiety disorder, bipolar, schizophrenia, been diagnosed on the spectrum, inattentive ADD, ADHD, motion sickness, vertigo, dizziness, clumsiness, or a history of a reading disorder, dyslexia, dysgraphia, dyspraxia, dyscalculia, I'm here to tell you that there's about a 90% chance, if not higher, that you've got a vision component related to those kinds of diagnoses.
And
which then...
Go ahead.
Well, that was going to transition me over to having the audience play along with us and do some visual imagery. And so here's my visual imagery. I want you to picture a 150-year-old dilapidated barn in the Nebraska countryside. And if you see that off in the distance, the first thing that you likely notice is the roof collapsing at the spine. And maybe the four walls are starting to lean. So if you keep that image in your mind, I'm going to say the right half of the roof collapsing would be commonly related to learning outcomes, reading, writing, and math. And the left half of the collapsing roof would be any of these behavioral disorders: ADHD, autism, panic, anxiety, OCD, ODD. Pick one, it's the other half of the roof. So we got learning outcomes and we got behavioral and mental health outcomes, okay? And I'm suggesting that perhaps before we send in a roof repair crew, drugs, or more instruction, we should wonder, well, is the collapsing roof supported by anything else? And in this analogy, yeah, the roof is supported by the joists. And in this analogy, the joists are a term called phonological processing, working memory, executive function, and maybe we put in rapid naming speed in the joist level. But the joists have to be supported by the four walls. And in this analogy, there's eye teaming, eye focusing, eye tracking, and something called magnocellular vision or motion processing. And we can talk more about that in a minute, perhaps. But that's the four walls. But the four walls have to be supported by the foundation. And in this analogy, the foundation is represented by some aspects of central auditory processing, a term called beat competency or millisecond timing clock, primitive reflexes, archetype movements, regulated vagus nerve, and the foundation has to be ideally poured over bedrock and not sandy, shifting soil built over a fault line, which would be represented by genetics, epigenetics, biotoxin illness, nutritional mineral dysregulation, things that fundamentally are affecting the gut and the microbiome and the entire body's ability at the cellular or at the mitochondrial level to produce the required energy just to function.
So, Doug, I want to interject because that point right there is key to much of why I do this podcast and talk to specialists such as yourself. We're working in the realm of integrative functional medicine. It's very easy to sometimes get lost in the, well, what is the best supplement for X, Y, and Z? Or what is the best exercise for this? And what you just hit on is fundamental, that whatever imbalance is happening in the body, from an auditory standpoint, a visual standpoint, a central nervous system, gut, musculoskeletal, whatever, there is a component, if you trace it back far enough, that it does come down to the fundamental aspects of good nutrition, health, microbiome status, things that are working at the cellular level, mitochondrial level, et cetera. It doesn't mean that you can't implement visual exercises or that you might not need glasses or that you might not hear hearing aids. But what we do as functional integrated medicine practitioners, and I put you in that category, is to not only focus in on a problem, but also expand and pull the lens back to be able to get a much broader view and work on these fundamental concepts. And I think that's important. And that's very, very true. One of the other things that I keyed off on that you were talking about was the link between the auditory system and the visual system, the central auditory processing, primitive reflexes. Can I just ask you real quickly, because that's something that I talk a lot about. the auditory processing issues that sometimes can manifest as attention problems, for example, or the primitive reflex issues that are retained in certain kids that then contribute to behavioral problems. So give the audience just a quick overview of a central auditory processing problem and how that affects the visual system, and then the same thing, if you can, for primitive reflexes.
All right, so from the lens of an optometrist, here's some of the things that I would tell you. So there was a pediatrician, Arnold Gazelle, back in the 50s, who worked with several of my optometric colleagues to study infant development, including vision development. And he was a prolific author. And one of the books that he wrote was Vision and Child Development, or something along that title. And I'm pretty sure he's the one that was quoted as saying something along the lines of, if you want to understand the whole child, you have to understand their visual system. And if you want to understand their visual system, you have to understand the whole child. So it's not a pair of eyeballs disconnected from the rest of their brain and body. And I think we tend to lose sight of that, right? Because from the 2020 mindset, you think, oh, well, vision just goes into your brain and you see. And I would argue that we don't see with our eyes, we see with our brain. And the retina is specialized brain tissue pushed out into the eyeball. The coating around the optic nerve and the white part of the eye, or the sclera itself, is an extension of cranial membrane known as the dura mater. It is 3/4 or so of the 12 cranial nerves are directly tied up in vision. And here's an anatomy fact that's pretty mind-boggling. So I'm sure there's some rounding numbers, but generally speaking, there's estimated to be 3 million sensory nerve fibers that feed information to the brain, classically vision, auditory, taste, touch, and smell. And of that 3 million fibers, there's estimated to be 30,000 auditory neurons per ear and roughly 1.2 million per eye.
Wow.
That's a lot of sensory input tied up in vision, and not in simply the 20/20 or the eye health circle. That's in that third circle. So one of the things that I frequently talk about in my own practice with patients is we talk about those numbers, and I say, here's what all of our brains are supposed to be doing at a subconscious level. Our subconscious mind should be able to ask and answer the question, do I feel safe? And remember, that question is supposed to be asked and answered below the level of conscious awareness, because we want your conscious mind to be available for processing the world around you, how you and I interact together, how I learn in a classroom. Can I walk across the street safely and not get flattened? So we want the conscious mind and all of our sensory systems to be available for that kind of processing. And if I go back to the anatomy, and I'm oversimplifying this, I'll grant you, because we could go into a giant discussion about the gut and the microbiome. But in our discussion today, because 2.4 of the 3 million sensory inputs are tied up in vision, our primary threat detector is vision. If you heard something around you that was threatening, you would turn and look. You don't look at something that's threatening and then look away and lean in with an ear to make a final decision about, is that a threat or not? In that regard, it's all about vision.
Right. That's a great point.
So, and then I think we also have to have an appreciation for how we've evolved to have the visual system that we have. So if we simplistically break the world into predators and prey animals survive by having eyes on either side of their head, so they have almost a 360-degree field of view. They have very little binocular vision. Their coloring allows them camouflage. They're fast, short-term sprinters. If we could talk to prey animals, they'd all get diagnosed with panic and anxiety disorders and ADHD. and they like to play dead or play possum, if you will. So that's how prey animals survive. We survive as a predator by having eyes closely spaced in our face that are supposed to work together as a well-synchronized team, whether we look right, left, up, down, in, out, any of the diagonals. They're supposed to say fuse together as a team. We have a magnocellular or a motion processing system, which I'll circle back to in a minute. We are good pattern detectors to break camouflage. It's why we like playing Where's Waldo and word search puzzles and hidden picture puzzles. It plays to our strengths as a predator. We hunted in packs. And yes, we're short-term sprinters, but we're also marathon runners. So way back in the day, if you could only hunt with a spear, you basically had to run a prey animal to ground until they were so exhausted that you could then go up and finish the kill. But that's the world of predators versus prey animals. So if you and I were walking down a game trail, looking at 12 o'clock, thinking that we saw something in the brush, our attention would be focused at 12 o'clock. All of our attention, visual, auditory, motor, our whole body is focused at 12 o'clock at whatever distance we're looking at. But the deer that heard us coming is at 10 o'clock off the game trail, hoping we don't see it. Hence the term like a deer in headlights. The lack of movement and their coloring, that deer is hoping it blends into the background. But we're not potentially the only threat. So its ears are moving around like radar dishes, capturing sound. And our magnocellular system, at least part of it, is processing movement in our environment below, right now, the level of conscious awareness. So if the movement of that deer's ears is disparate with the wind that's blowing the leaves it's trying to hide in, our magnocellular system, if it's functioning optimally, will pick up that movement disparity, push it up into our conscious awareness, and all of our attention would be redirected to where we perceived that disparity of movement. Does that make sense?
It does. And I mean, the way that I'm seeing this, Doug, and tell me if I'm off track, but you know, we talked about auditory processing, right? The brain not processing the auditory signal in an equal balanced fashion and integrating it. So you're basically getting mixed signals, or what I sometimes call static. The same kind of thing could happen with primitive reflexes. As we're developing as a newborn and then we grow, we're supposed to lose some of these primitive reflexes that are inherent within our nervous system so that our nervous system becomes more integrated, developed, and sophisticated. And if they're left behind because they didn't go away, or the nervous system didn't develop normally, whatever, it's static. And so we just have more static in the system, more noise in the system. And what you keyed off on was the prey animal, right? If you were to be able to have a conversation with them, they'd all be diagnosed with anxiety, panic, and ADHD. So I I see this as a discussion when you start looking at the visual system too, because the visual system, with all the sensory input from the eyes into the brain, millions of these signals, it is a predominant organ from a sensory standpoint, but it needs the signal balance from these other areas for things to function appropriately. And basically, you could really get down to, I guess, that if you have imbalance in any of these systems, it is going to heighten the level of internalized stress. And for individuals, well, all of us really, is that inherently or intrinsically, or I can't remember how you described it, we feel unsafe. Even if we feel unsafe, maybe on a sort of a subconscious level, that can translate into perhaps imbalances or problems in our life. Easy frustration, heightened levels of anxiety, poor sleep, poor focus, poor concentration, behavioral issues in kids, whatever. Does that make sense? Do I have that right?
Yes, because remember, and to be nitpicky, at the mitochondrial level in our cells, the mitochondria doesn't know why it's not burning oxygen efficiently to create sufficient energy for us to run every system in our body. It just knows that it's not burning oxygen efficiently, meaning that at the mitochondrial level, our mitochondria doesn't know why they're stressed out. They don't know why they're vitaminally and minerally and perhaps hormonally dysregulated. They're just chugging along, doing what they can with the raw materials we're providing it. And so at the end of the day, I frequently remind people, stress is stress. It could be money stress, work stress, inflation stress, world stress. It could be visual stress. And then that goes back to that third circle of the model and reminding them that if 2.4 of the 3 million neurons feeding information to the brain are dysregulated, let's acknowledge and own that as visual stress.
Right.
And this is where things get really fascinating too. So I'm going to hold this up, even though we're just being auditorily recorded, but I'm holding up right now an optokinetic drum. It's a cylinder about 14 inches tall. It's roughly 8 inches in diameter. It's supported by a wooden handle so I can spin the cylinder. And from top of the cylinder to the bottom, there's alternating black and white stripes that are roughly a half an inch in width. And I'm telling you about that because I frequently have people that cannot look at that without causing it pain or discomfort or dizziness or even vertigo. And so I oftentimes will pull that out and I'll hold it. I'll start maybe 4 or 5 feet away and I'll say that to them, is this comfortable or not comfortable to look at? And usually their facial expressions give it away even before the words come out of their mouth. But it's frequently like, I do not like looking at that. No, it's uncomfortable. And I've learned from my patients over the years to then ask better questions. And then I say, well, where do you feel this? In your eyes, in your head, in your ear, in your jaw, in your throat, in your chest, or in your gut? And frequently people will say, oh, I didn't think about all those things, but let me think about that. They're like, oh, I feel it in my chest, or I feel it in my gut. And then I'll say, well, can you imagine it's going to be better or worse if I spin it? Oh, don't spin it. I'm like, well, now I have to spin it because we have to find out, is it really worse? Well, it's usually worse when I spin it. I haven't found someone yet who understands the neurology much better than I do about, well, how come I've got some people, when I spin it from their right to the left, they'll feel it in their eyes and their jaw, but if I spin it from their left to their right, it'll go to their throat and their chest. I don't know. I just know that it's variable. And then pretty classically, for those people that really find that drum annoying, I will tilt it away from them and I'll say, swallow a couple of times. They're like, you want me to swallow? I'm like, yeah, I want you to swallow. Okay. And then I'll show them again, first without spinning and then spinning. And then I'll say, is it harder to swallow when you look at the stripes? And for the people that we're talking about, they pretty much can't swallow. And they're like, what is happening? And I say, okay. I'm like, I'm simply telling you that your autonomic nervous system, the part of our nervous system that is involuntary and reflexive and rooted in protection and survival, feels like it's being physically assaulted by those black and white stripes. And we have a quick chat about the sympathetic nervous system tied into fight or flight, the parasympathetic nervous system, rest and digest. And I said, so when your nervous system feels like it's being assaulted by those stripes, it's upregulating your sympathetic nervous system, it's downregulating your parasympathetic nervous system, and it's shutting off your salivary glands, and you're pumping out stress hormones.
It sounds like it's some sort of vagal problem in these pieces, or we're part of that polyvagal
Yes.
aspect that Dr. Porges has talked about in the past. So, and that could relate to a lot of things. That could relate to gut problems, things coming from the gut. That could be related to traumatic events, a whiplash injury, some other fall, an injury to the sacrum, an injury to the spine, cervical spine, thoracic, wherever. And then obviously a wide variety of other effects. So that's very interesting, and I can appreciate how some individual would be so extremely sensitive, and then that being a triggering event to their autonomic nervous system dysfunction. So we know that, Doug, we get down really to the roots of this, and we think about what people can do, of course, healthy diet. We sound like a broken record. I know a lot of times we talk about these things, microbiome. Those are all other discussions. But I'm curious from the vision therapy standpoint, and this is a huge topic, but let's talk about how common things that you see that create problems for people that are often overlooked, that are embedded in the visual system, but they often get overlooked. So a whiplash injury, for example, a concussion, an adverse reaction to, a vaccine where you're getting some sort of inflammatory response, a post-infectious process. What are some things that you're commonly seeing in your practice that tend to assault the visual system and its integration into the central nervous system?
Oh, I love the question. Thank you for that. So let me approach it in this way. My mindset, and this is not only just in my practice, by the way, this is true anybody I might meet and chat with on the pickleball courts, or a bank teller, or somebody I might chat with in the parking lot somewhere. I'm going to presume everybody I meet has a third circle problem until they prove to me that they don't. And the way I initially try to gauge that is there's something called the step vergence test, or the jump near point of convergence test. And I'll describe it for the audience. So I have somebody look straight ahead across the room. I take a pen, and from above their head, down between their two eyes, at eye level on their midline, roughly 2 inches from their face, I'll drop my pen down while they're still looking across the room, and then I'll ask them to try to look at my pen. And I'm looking to see if both eyes will converge. It is the easiest way to open this discussion up, because When I video it and then show it to them, and both eyes don't converge, maybe the right eye converges and the left eye actually goes out away from their midline. Well, now we've got a platform to talk about binocular vision. And then that will lead right into the discussion about, well, first of all, do you like to read? Well, not really. Have you read a book since you graduated high school? No. Is that because when you do read for more than 10 or 15 minutes, you get sleepy, tired, bored, lose attention, lose your place, skip over words or lines, can't remember what you read? Yes. I'm like, that's connected to this binocular vision discussion. So a handful of questions, and the jump or step vergence test is the easiest way to start to break into this discussion. And as a way of example, I had a guy, he's a new patient this morning, mid-30s, and we do this exact thing that I'm telling you. I ask him about reading. He waffles on whether he really likes doing it. I do the jump near point convergence test. His left eye goes out. As I'm talking about this, I'm watching his left leg swing over the edge of my exam chair. And I said to him, I'm like, you see your swinging left leg? And his leg's swinging. He's like, what are you talking about? I'm like, look at your left leg. It's swinging back and forth over the edge of my exam chair. I said, that is connected to the video I just showed you. What? So then we do another measurement where I can reveal to him that his brain is intermittently turning off his left eye. But his brain keeps both eyes on better when he's swinging his leg.
Oh, that's interesting. Is that type of thing, is that a fairly common thing to see with a head injury, for example? I mean, even, or something else?
Yes, but let me go back to the question, because that took me off on a bit of a tangent.
Sure.
So anybody that walks in my front door, here's what I'm contemplating. Can I help them? And what are my treatment choices? Well, granted that there's more than this because of the way that you practice and all that brings to the table, but simplistically, here's my choices. Somebody walks in my front door. Do nothing is a treatment option, right? Do no harm. So maybe I don't have anything that's going to help them, and I'll acknowledge that if that's true. Or do they need medication? Hey, if you got a pink eye and you got a bacterial infection or you have glaucoma, okay, is this a medication problem? In our discussion, what we're talking about, no. What about surgery? Well, if you have diabetic retinopathy or retinal detachment, okay, maybe you need surgery. But then what am I left with? I'm left with lenses and some sort of vision therapy discussion. And usually on my first visit, I'm trying to determine, can I make your quality of life better with my kind of glasses that include prism or color? And I'm just telling you, Kurt, I love what I do. It's so much fun, I can hardly stand it. Because when I find a prism and a combination that works, your breathing gets better, your tight jaw loosens up, the trigger points in your neck and shoulders improves, your touch sensitivity is less, you can tolerate my fluorescent lights in a much better way, you can look at print in a way that you probably never looked at print before, and your auditory spatial localization skills and your sound sensitivity improve on the spot.
So, Doug, I think that's another really important point. Is something that flashed in my mind is that when you're talking about these sensory nerves, was it 2.4 million, for example, of the 3 million, that are coming back from the eye to the central nervous system, The simple, I don't want to say simple, it's not simple because but maybe in the context of this discussion, we can say the simple change of prism or just the colorization or that signal for many people can be enough to turn the volume down in their overstressed nervous system, which gets to your point about the importance of the eyes, not just 20/20, oh, I see real clearly, that's great. But there's another component, always another layer to this from a nervous system standpoint, that you might have 20/20 vision, but the way you're perceiving things from a sensory standpoint out in the world is not coordinated in a regulated fashion into your nervous system. And all of a sudden you engage your sympathetic nervous system, downregulate parasympathetics, and you're in a fight or flight response and you don't even know it.
Yep, and that just becomes your habituated state.
Right.
And you think well, it is your normal, it's just not normal.
Correct. And then you follow suit from there, when you start getting, abnormal stress response, cortisol production, catecholamine production, that starts to impact things at a cellular level, at a microbiome level. I mean, that we could go off into tangents into any one of those particular categories. By the way, one of the other things I just want to interject is it's important for people to understand that when you're in this particular discussion, we're talking about sort of the stress-related effects that can happen with imbalanced sensory system. But every time our body is stressed, it requires more energy production. And you touched on mitochondrial activity. And we often wonder why people are so fatigued, whether that's physically, mental, emotionally, visually, like I don't like to read because it makes me tired. Well, all of these systems, including the autonomic nervous system, the parasympathetic, the sympathetic, and everything in between, requires energy production from mitochondria. And so every time we're turning up that volume of stress, we need more energy production, and we put added stress on our mitochondrial system to do that. That takes us back to the fundamentals of healthy eating and a healthy lifestyle. All of those components get wrapped up in this discussion. So that's fascinating. And I've seen some patients in my practice over the years who become more integrated into the world when they do the prism lenses or they do different types of lens therapy or other types of vision therapy type exercises. And I realize there's a large list of those. It's a very in-depth specialty. So continue. I wanted to interject that because the way I'm sort of visualizing this, even for myself, is that we're all potentially vulnerable to these things, and sometimes we don't make the connections. And again, I think a lot of times if you have 20/20 vision, you're like, thumbs up, everything's good, but not necessarily.
Yep. Yes. And so let's go back to that energy production. Hence the expressions, I'm so tired I can't think straight. And its first cousin, I'm so tired I can't see straight. Yeah, that's a binocular vision problem. Absolutely, that's a binocular vision problem. And if nobody ever measures you for this, you don't know that it's even a problem. You're chasing after symptoms and diagnoses that are legitimate symptoms, but the root cause oftentimes is an undiagnosed vision problem. Here's a couple of examples. So I met a guy a couple years ago who 13 years prior had a traumatic brain injury from a beam. He owned a construction company at the time. Some beam fell from wherever they were trying to place it and cracked his skull. 13 years before I meet him. And he met the founder of a brain injury support group that I know. I talked to this group 5 or 6 times over the years. He found that group, and before he found the support group, when he originally got referred to me, he said, Doug, I was on a first name basis with the suicide hotline. This is 13 years subsequent to his brain injury. his life is miserable. So he finds a brain injury support group. That is key for him from a social, emotional perspective. So I see him, and he's still 13 years into this. He's got substantial weakness in his left side. So he's got 14 pounds of grip strength in his right hand, and he's got 2 pounds of grip strength in his left hand. And that's him mustering up all the energy he can just to get the 2 pounds of grip strength in his left hand. And I find a combination of prism and color, and his grip strength goes up to 12.
That's amazing.
Immediately. It is amazing to me.
Yeah.
I have 2 patients now recently. One seemingly has suffered a severe vaccine injury, now going on 2 years, because she started going down the tank a week to a week and a half after she got the second vaccine. And she comes in slowly with a stride length of about 4 inches, pushing a walker effortfully. She's lost basically her motor skills. She's lost efficiency in using her voice. She's got lots of eye movement control issues, but I'm telling you that because I find the right prism and color for her. She's starting to get her voice back and her stride length lengthened while she's in the exam room.
So real quickly, Doug, and we're coming to the end of the interview, but can you explain real briefly, and then I want to interject something else, and then as we sort of come to the end here, but what the color, the prism, in layman's terms, what's happening? Why is that, let's just say, turning down the volume of stress and causing things to integrate? What's happening at that level?
Okay, so let's talk about color first. Here's the analogy I give to people in my office. I said, imagine a number line from -10 to +10, and 0 is homeostasis, right? Life is in balance at 0. That's where we generally want to be. I said, if you're on the -10 side of the scale, odds are that you're suicidal and you perceive the world as a dark, forbidding place. You pull the curtains closed, you pull the blankets over your head, it's dark. Okay, if you're a -5, you're probably an old jazz singer singing the blues.
Uh-huh.
And if you're on the +10 side of the scale, you're epileptic, and maybe photoepileptic, where certain rates of flicker will actually cause seizures. Maybe at A7 or an 8, you got an easy migraine trigger. Again, usually with black and white stripes or flicker, they're really big migraine triggers. Maybe you're a 6 or 7, you easily get motion sick in the car, you have to be the driver, you tend to bump into the corners of door frames or the edges of tables, or you hook your toe on the bedpost. You just tend to be clumsy. Or you've got a short fuse and you're cranky more of the time than you should be. So if you're on the minus side of the scale, the truth is you need yellows and oranges and reds because they're more arousing colors to our nervous system. And if you're on the plus side of the scale, you generally detest brighter colors like reds and oranges and yellows. And in order to drag your hyper-excitable, easily triggered, overly sensitive nervous system, to drag it back towards homeostasis, you literally need to feel blue, or what blue does to your nervous system, because it's the most calming of the colors. Sage green, lavender, but most of the time, true blue, right? Because green's got yellow and lavender's got red. So most of the people that I see that have that amped up nervous system, needs their whole nervous system to be dampened down. And I would help the audience understand that about 80% of our optic nerve goes to the visual cortex, or what we know as a conscious seeing experience. But roughly 20% of the optic neuron branches off into other locations in the brain, not related to conscious awareness, but a number of these neurons from the optic nerve go directly into the hypothalamus and its connections to the pituitary gland.
Oh, that's fascinating.
I'll send you an art.
That's really interesting, because you think about, well, we talk a lot about hypothalamic pituitary adrenal axis dysfunction induced by chronic stress.
Yep.
Well, that's really cool. That's really interesting.
And the prism is equally interesting in its own right. So I've had people that, let's say they've had a stroke and they've still got left side weakness, and they tend to maybe drag a leg, or when they walk, they tend to drift to the left. If I find the right prism for them, it will help them refine their center, and they'll walk immediately a straighter line.
So what you just mentioned about the optic nerve, I'm just kind of keying on that, and then the prism too, right? So it's all about balance, safe signals to the brain. But the 20% of the optic nerve fibers going to, like, the hypothalamus into that system, I mean, that's huge. If you understand the implications of that, in that system is linked to everything else. It's linked to our immune system, it's linked to our cardiovascular system, it's linked to our nervous system from a much broader standpoint. And then, I mean, so this is truly profound in the fact that clearly, again, going back to the beginning, the eyes are more than just a visual vehicle.
Yes.
They're a major sensory vehicle of that is integrated, and really, really fascinating. That please send me that article for sure. Yeah.
And then I want to maybe, man, there's so much we could still talk about. But think about this for a second. So I'm going to oversimplify this, but the postural muscles that hold and move the body in space generally don't really do anything that the brain doesn't tell them to do. And the brain doesn't tell the postural muscles what to do, how to fire, how to move, create a motor action plan, walk across a room, pick up a coffee cup, hold a pencil, whatever, without checking in with vision first. So one simple way that I describe this to my patients is I say, imagine that your body is your cell phone, and your two eyes are two global positioning satellites that have to triangulate space around you to create a Google Maps directional plan for your body to move and hold itself in space. And if your motion processing and your binocular vision skills are not synchronized, they're not fast, accurate, effortless, or easily sustainable, you're going out of synchrony, and that's going to show up in your whole body.
So, Doug, I want to finish up with one comment, and then I want to ask you just for some advice. The main comment I want to make as I start to think about this, we think about the visual system, the eyes, the central nervous system, the brain. People get that concept. You can now start to see how things that we're exposed to, foods, chemicals, metals, mycotoxins from mold, anything that has an adverse influence on the brain and nervous system, okay, or the eyes, or both, right, is going to have a potential adverse effect of creating dysregulation, creating imbalance, cranking up that stress response, and creating all kinds of havoc. So I'm going to have you back. I want to have you back on future episodes to talk about some of these other concepts, because this is, as you mentioned, we could be here for hours. I also see that, again, tell me if I'm off base, but I don't think I am. But the types of things that we're exposed to, the types of images that we see, okay, from whether it's, peaceful images, nature scenes to violent scenes to whatever else, that too has a stimulus within our nervous system. And maybe this is a topic for another discussion, but we're now living in a culture where everybody is on phones. And we see it as a big problem with kids, but adults too. People staring at their cell phones, staring at the computer, staring at their iPads, whatever else. I see that as a big problem in that there's this constant artificial stimulus, well, not artificial, but stimulus coming into the eyes. But the way our heads are positioned, the way our eyes are having to converge on a very small screen, that has to have a negative influence at some level. I'm sure it does. I don't completely understand all the mechanisms, but from an intuitive standpoint, I can't imagine us escaping a heightened stress response because of it. Am I on track? Is that truthful from your perspective?
I don't think I've seen this specifically in my own practice, but there is something called cell phone esotropia. There's case reports of patients where they spend so much time on their phone that they develop a condition called esotropia, where their eyes cross and get stuck crossed, where they're now seeing double.
Wow. Oh my gosh. Okay.
That is disturbing to me.
Yeah.
Now, here's an interesting story for you. So a couple years ago, I've got a guy who was, I think, in his third year of osteopathy school, and he was out on medical leave because he had one too many concussions. Okay. He finds the brain injury support group. They tell him to come and see me. I give him a pair of glasses with color and prism because I want to know right out of the chute, can I improve your quality of life? We'll get to the vision training discussion if we need to, but my mantra is if you're happy, I'm happy. If I can make your quality of life better with my kind of glasses, maybe we don't have to have a vision therapy discussion, but nonetheless. So the glasses gets him back in the game. Okay. He's not 100%, but he's better. He's also got a connective tissue disorder, so his body wants to go out of alignment all the time. So he called me about a year after I originally saw him and said, well, let me tell you what's going on, okay? I got treated by another colleague that I really wasn't ready for, and I don't know what he did from a craniosacral perspective, but he shifted the bones in his cranium around, and this guy took a big turn for the worse. So much so that he basically said to me, I can't look at print on a screen or in a book for more than about a minute and a half before I'm in pain. Okay? So he said, I found another osteopathic colleague who's been in practice for a long time here in Southern California. He said I should come back and see you. Okay. Why did he tell you that? Well, because he felt my right temporal bone and thought I might have some uncorrected astigmatism. I'm like, well, I do weird stuff. I'm like, yes, come back in. I want to know. So his baseline is the original prescription I gave him. I gave him one click of astigmatism in his right eye. His jaw loosened up. I gave him 2 clicks of astigmatism, and his rib cage and his diaphragm on his right side lengthened, and he could breathe in a better way. Mm-hmm. I put that over the original glasses, sent him across the hallway, and he sat and read on his computer for about 20 minutes.
Wow.
Everything's connected to everything else.
Yeah, it sure is. Wow, that's really cool. It's amazing. lots of these kinds of examples. Okay, so Doug, short of right, my feeling is that the people who are struggling with just chronic stress, chronic health issues, neurological problems, behavioral problems, mental, emotional stressors, they need to seriously consider not just eye health. Of course, that's important, right? The diet, but the type of work that you do to see if there's some sort of dysfunction, dysregulation of the visual system, central nervous system. How do people get in contact with you? Resources that you have. You've sent me some information, but where can people find more about what you do and what this kind of work is all about?
Yep. So I'm gonna be sending you some websites that kind of link to. So here's the challenge. I have a number of websites to send you, and they're bits and pieces of what I have become. And the challenge is, how do you find someone like me in your own backyard? Because we want to understand the falling down barn analogy, because I want you to be able to get comprehensively assessed and not just bits and pieces of it. So it'll be a challenge, but what is it? 1,000-mile journey begins with the first step. The first step is you got to know that the third circle exists. The second step is going to be look at the show notes, find some of these links, start to go learn more about what we're talking about. You'll ultimately be able to find my website, find my own podcast called Move, Look, and Listen. And I'm always happy if people reach out to me to either help them find somebody close to home or understand what their needs are better. And sometimes people will come out and see me. I'm in Southern California, but I've had people from New York and New Hampshire and Florida. I had a family a number of years ago, not just for me, because that would have been ridiculous, but they were coming over here to the States to do a family intensive on primitive reflex integration, which we really didn't get to. But this family went to that conference and flew to see me from Singapore.
Yeah,
which is ridiculous.
No, I believe it. I mean, the thing is people like you and the kind of specialty training that you're providing is not available in many other places. So it's unique, it's important, it's critical. And, I think this is a really, really important thing for people to be aware of. And for practitioners that listen to this podcast, it's to understand and appreciate that, again, we're not just talking about glasses for 20/20 vision.
Yep.
It's to understand that the eyes, as we've mentioned throughout this interview, are an integral part of our nervous system. The nervous system is quite vulnerable and sensitive to our environment, both internal and external. And this can be a missing link, a missing component for people with chronic health issues of a wide variety of things that they may not be getting well. So I want people to take this seriously, look at the information. So Doug, it's been fantastic. I appreciate your skill set, your knowledge. I've learned so much from you. I look forward to having you back. So thanks so much for joining me.
Happy for the invite. Thank you very much.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.